Welcome back to 5 to Thrive with Hart. I'm Tony Hart, and this is where we take employee benefit issues that can feel complicated, expensive, or just easy to put off and break it into 5 practical ideas employers can actually use. The 5 is simple. Every episode gives you 5 ways to think through benefit decisions, cost drivers, plan design question, or stewardship issue. And the Thrive is the outcome we're working toward. A benefit plan that's more strategic, more sustainable, and more valuable for the people it's meant to serve. Now, that doesn't mean every employer needs the same plan or the same vendor solution. It does mean employers should have a clear process for asking better questions, making thoughtful decisions, and protecting both their people and their benefit investment. So today we're talking about a big one. Why your benefit plan isn't just a vendor product, it's a business asset. Your benefits plan isn't just insurance. It's one of the largest investments your company makes in its people. But a lot of employers still manage that investment one renewal at a time. The renewal comes in, a few options get reviewed, maybe the deductibles change, the co-pays change, or employee contributions go up. Then the plan goes back on the shelf until the next renewal cycle. I think the better question isn't just how do we get through renewal? I think the better question is, are we managing this plan like the major business asset that it really is? Because underneath the renewal increase, are much bigger questions. What are we paying for? What is actually driving up cost? Are our vendors making strategic decisions for us? Are those decisions aligned with the company, the plan, and the employees using it? And can we clearly explain why the decisions were made? A strong benefit plan isn't built because someone found the lowest renewal increase one year. It's built when leadership has the disciplined process to review the data, challenge assumptions, evaluate partners, and make decisions that protect both the company and the people on the plan. So let's talk through 5 ways employers can move from simply renewing benefits plan to actually governing it. The first way to manage your benefits plan like a business asset is this. Use your data to identify problems before they become a crisis. A lot of benefits reporting is backward looking. It tells us what we spent last year. It shows us claims. It shows us prescription trends, and it tells us where the renewal landed. And that information matters, but strong benefit stewardships ask different questions. What may happen next year? What categories are growing faster than expected? What's changing in pharmacy spend? Are specialty medications increasing? Are we seeing more emergency room use, imaging, musculoskeletal claims, or avoidable care? Are we paying more without actually seeing better outcomes? The goal is not to build a giant dashboard that nobody looks at. The goal is to identify 1 or 2 meaningful decisions that need attention before they become major cost problems. For example, pharmacy costs may be rising faster than medical costs. Now, that does not automatically mean the answer is to reduce coverage. It means that employees need to ask better questions. Is the increase coming from utilization? Is it unit price? Is it specialty medication? Is it the formulary, the network, or a better clinical pathway we may not be explored yet? That's where the benefit strategy begins. Not with a renewal quote, with a clear understanding of what is actually happening inside the plan. The second way to manage your benefits plan like that business asset is this. Outsource administration if needed, but do not outsource strategy. Your carrier, PPM, TPA, consultant, or other vendors may be important partners, but that doesn't mean they should automatically control every strategic decision affecting your plan. Employers should be asking who's making decisions about our pharmacy network, who's making decisions about our formulary, who determines how the vendors are paid, who's evaluating whether clinical outcomes are actually improving, and who's responsible for making sure the plan dollars are being spent efficiently. Here's the question that matters the most. Are we accepting a vendor's process because it's truly the best option for our plan, or are we accepting it because it's simply the standard option they offer everyone. I think there's a big difference there. Not every employer needs a direct contract with providers or pharmacies, and not every employer has the size, resources, or the operational structure to do that. But every employer can ask whether the current model is working, and every employer can challenge the phrase, we can't do that, because a lot of times we can't do that just really means that's not how we usually do it. Employers, they fund the plan. That means they often have more leverage than they really realize. And the goal is not to become adversarial with your vendors. The goal is to become intentional. You can outsource some mechanics, but you should retain ownership of the decision process that materially affect the people, your budget, and the long-term plan risk. The third way to manage your benefits plan like a business asset is this. Demand evidence and accountability from every vendor. The benefit space is full of vendors promising savings, better engagement, stronger outcomes, lower trend, better navigation, better pharmacy management, and better mental health support. Some of those vendors may be excellent, but the first question should not be, do I like this solution? The first question should be, what specific problems are we trying to solve? And start with the data. Identify the actual issue that's inside the plan. Then evaluate whether the vendor can solve that issue. When you're reviewing vendors, ask, what exact metric are you going to use to improve this? What is our baseline? How will we measure success? What assumptions are built into your return on investment projections? What results have you delivered for employers similar to us? And what happens if the projected savings don't materialize? So here's another question that doesn't get asked nearly enough. How much of your fee are you willing to put at risk based on performance? A vendor doesn't have to guarantee every outcome. Healthcare is complicated, as we all know, but when a company makes bold claims about return on investment, an employer has every right to ask how confident the vendor really is in the results. The best vendor relationships, they are not built on a polished, pitch deck. They're built on transparency, shared accountability, measurable outcomes, and a clear understanding of whose interests are being served. The fourth way to manage your benefit plan like a business asset is this. Design employee engagement around value, not just incentives. Employee engagement doesn't happen simply because a company offers a program. $25 gift card, a flyer, a few reminder emails, that may get some participation, but when an employer truly needs people to use a higher value healthcare option, the plan design has to make the choice easier, clearer, and more affordable. That doesn't mean punishing people. It means creating a thoughtful path. For example, an employer may identify a preferred pharmacy, care navigation option, provider model, or a treatment pathway that can deliver the same or a better clinical result at a lower cost. Employees may still have choices, but the higher value option should generally be the one that is easiest to access and the most affordable to use. That is much more effective than simply saying, we'll give you a small reward if you try this. People, they respond to clarity. They respond when they understand what is changing, why it's changing, how it helps protect the affordability, and what their options are. The best benefit communication is not we're taking something away. It's we're trying to help you get the care you need while keeping unnecessary costs from being passed back to you. That is completely different conversation. And when employers pair a good plan design with clear, respectful change management, engagement tends to follow. Your fifth way to manage your employee benefits like a business asset is this. Document the process behind your decision. Good benefit stewardship is not just about making smart decisions. It's about being able to show how that decision was made. What data did you review? Who participated in the discussion? What alternatives did you consider? What vendor conflicts or compensation arrangements did you evaluate? How did you assess clinical, quality, costs, employee impact, and implementation risk? And how will you measure the results after the decision is made? This is where a disciplined benefit governance process is valuable. Benefit plan stewardship should not only live in somebody's memory, an email chain, or a renewal spreadsheet. It should be organized. It should be reviewable. It should show how the company has taken thoughtful, evidence-based approach to managing a major employee investment. That's one of the reasons why I built the Benefit Investment Blueprint. The BIB is not just another benefits presentation or renewal checklist. It is a framework for documenting the company's benefit strategy, vendor reviews, plan decisions, and follow-up actions. It helps create a more consistent process for reviewing the plan year-round, not just at renewal and when that renewal arrives. The BIB is not a legal advice. It doesn't replace ERISA counsel or compliance guidance, but it can help an employer build a better internal documentation and support a more prudent benefit governance process. So here's the takeaway. A better benefits plan is not built trying to eliminate every complaint, and it's not built by adding every trendy program, and it's not built by waiting until renewal season to start asking questions. It's built through a consistent stewardship. Use your data to identify the real cost drivers. Keep strategic control of the decisions that matter. Hold vendors accountable for evidence and outcomes. Design employee engagement around value, and document the process behind your decisions. You don't have to fix everything at once. Start with one issue, one cost driver, one vendor relationship, one plan design decision, or one area where the company needs more visibility, more accountability, or better documentation. That's how to move from annual renewal management to year-round benefit stewardship. And that's how you protect the plan, the company, and the people who depend on it. Thanks for watching 5 to Thrive with Hart. For one practical employee benefits idea each week, subscribe to the 5 to Thrive weekly newsletter. You'll find the link in the post, the video description, or on my profile. And if this was helpful, hit like, follow, or subscribe. And share it with someone who helps make benefits decisions.